there, and thank you very much for inviting me today. Well, as you said, I am mostly conducting research in the field of vision and vision impairment and vision rehabilitation. I'm specifically interested in what happens in real life because people don't necessarily only have a visual impairment. They may even also have a hearing loss or mobility problems, trouble with cognition. So I try to stay as realistic as possible to look at how people really grow older. Yeah, I think that the question of considering things together is becoming more and more important. Uh, there are different models of how we look at the idea of healthy aging now. And in order to be able to support people as they age, it is essential for us to consider the person, their environment, their larger context, and their reality is really what allows us to assess and help them in functioning optimally. The World Health Organization has created something called the ICOPE, which is the Integrated Care of Older People. And it is a model that will consider multiple potential impairments all at the same time. That includes vision, but also hearing, mobility, nutrition. And so all of these things really play together because they will allow us to age well. I'm also really interested in this integrated care context when we look at topics like dementia, because in recent years it has become more and more obvious that healthy aging, specifically healthy cognitive aging, is also linked to sensory health because both vision and hearing are identified as potentially modifiable risk factor for dementia. It's funny when you think about vision and hearing because they are, for example, right now, the two key sensory pieces for us to allow us to do this call, right? We are interacting visually, we're interacting through hearing as well. And so I think it's always a good reminder and a great example how much of our everyday activities all somewhat depend on vision and on hearing. It is really the basis for us to interact with others, the basis for us to interact with the life around us and to remain also independent. So I think that this is an easy way also for people to imagine how difficulties in vision and in hearing specifically may actually threaten people's independence, especially as they're getting older. And so from that perspective, I think both vision and hearing are very, very high priorities in order for people to age well. So there are many other variables that have been identified that really contribute to our independence and quality of life, our ability to socially participate. You can imagine that, for example, physical health and exercise or activity, this doesn't mean you have to run marathons, but simply to be active in your day means you will have to get around. And so vision is often linked to the ability to be independently mobile, right? There are some risks about falls, for example. There's also simply the ability to orient yourself, especially if you're in a new environment. And so vision plays an important role in this context as well. Yeah, I think that we often think of the big four. So the most important age-related conditions in terms of vision are cataract, which of course is treatable. So this is good news. This is something where we can do something. But then there's also macular degeneration, glaucoma, and diabetic retinopathy. So these are three conditions that are also somehow systemic based. So, for example, macular degeneration is a retinal degeneration that affects individuals' ability to see fine detail and to see central vision. So it's easy for me to simulate because this way you would simply not see my face. But if you would, for example, look sideways at me, you might be able to see a bit more. However, your peripheral vision will always be in good condition. That is not affected. If you look at glaucoma, here it's reversed. Usually, this is a condition that affects peripheral vision. As it progresses, it's a little bit like becoming tunnel vision. This is linked to the pressure in the eye. So, this is something that needs a lot of monitoring because it's also not painful. And then the third one is diabetic retinopathy, which is, of course, linked to diabetes, often when specifically diabetes is not well controlled. And so it can become a problem for blood flow in the eye, and that will interfere with vision as well. Here it's a little bit less predictable. We often call it Swiss cheese vision because it's sort of unpredictable where places may be that are difficult in the visual field. And it's also not stable as it depends very much on the state of the diabetes. But to continue on your question on eye care and vision care in Canada, there's an entire spectrum of people that are available, but sometimes people are a little bit confused about who does what. People will be familiar with their optician, who is the person who actually makes their glasses. They may be familiar with their optometrist, which I think is always a great way to start your vision care journey in case you're not sure if you need some help. An annual, biannual appointment with your optometrist is a great place to start. They will be able to help you with your refractive needs and your glasses, but they will also be able to do sort of a general check of your ocular health and make sure that you are potentially on the right path. And they're also the perfect place for referral if you need to go to ophthalmology for a medical problem, or if you need to go to vision rehabilitation for somebody to assist you with activities of daily living and with managing your vision in daily life. And that is actually my clinical training. I am a low vision therapist, and so I mostly interact with people in the context of managing their visual abilities in their daily activities. Something that can be confusing is that, of course, health and health management is different in every province. And so, depending on where you are in Canada, you may have access to different things in different places, or you may have to contribute some financially yourself. Some of it may be covered completely. So there, I don't have one clear starting point for you. But as I said, optometry is usually your best place to get started. They will be able to answer questions about service delivery, about service pathways, also about what is covered by your local care, or what your personal insurance might cover as well. Sometimes these things are a little bit hidden in a paragraph and you didn't know you had it until you need it. I think that one barrier that we're currently working on a lot is simply the availability of services given staffing, right? There are likely never going to be enough optometrists and enough ophthalmologists. And what that also means is that there are often waiting lists, right? That is, especially when you're looking at a service that is covered within your health system, sometimes you may simply have to wait for it. And there are not always options available for private care where you could pay for it. So I think that that is a bit of a barrier at times. Of course, now me talking about multiple conditions that all might merge together as you're getting older, even if you know where to go and where you can have your service, you do have to get there. And so mobility plays a role sometimes. When you are there, you need to communicate. This is where hearing plays another role, right? Sometimes you may depend on family members or other services in order to manage transport. So you see that it's not just one thing. You have to manage the entire situation around accessing your care. Now, I've had very interesting conversations with people that have multiple health issues because sometimes people will prioritize according to what they think may be more important. So if you have to go to see your cardiologist and you have to see your ophthalmologist, maybe you prioritize your cardiologist because you believe that really is threatening, right? It might kill you. But it also turns out that you may overlook that your vision will help you manage your medication, If you don't manage your vision well, maybe crossing a street may become very dangerous, right? So people don't necessarily always understand the implications of what might happen if your vision is threatened. And it is just as important as any other aspect of your health. I was giving somebody some advice last week where we started laughing, but the thing is that it's an old saying, the squeaky wheel gets the grease. If you need something, you need to speak up, and you may have to remind others that you need this, right? Sometimes I've been in situations with any kind of healthcare provider who has a schedule, right? And so you may feel rushed. Slow them down, even though they may not always enjoy that. But you have to make sure that you advocate for yourself. You have to also make sure that you are potentially surrounded by people that can advocate on your behalf. So make sure that you understand and know what it is you want, and then you can ask for it. And don't be shy. I think that that's important. I think it's important for people to remember that you are not alone in this. I've seen great benefit also from people to simply seek peer support, whether that is in person or online. You can find out about resources that other people have accessed, and you might find even better or more efficient pathways of accessing some of these resources. So talk to others, talk to your friends, talk to your family, your neighbors, your community, because likely you're not alone. And some other people may have already solved some of the questions that you are still asking.